Again, I'm Lauren Carlson, veterinarian over at VCA. I graduated from Auburn University 2015. Put together a little presentation for you guys just so you have some visuals, and that way it'll look good on YouTube as well, in regards to feline infectious peritonitis. So FIP starts with the coronavirus. We all are much more familiar with coronaviruses than we ever have been in the past before, but is not related to COVID-19. It's just the shape of the virus that they call it coronavirus. This one is species specific. It affects the GI tract of cats and causes diarrhea before it causes FIP. So there's feline coronavirus, and then that virus mutates into what we know as FIP. But many, many cats have this virus already in their systems, and it can lay dormant. It can live in their GI tract for a long time. It's highly contagious, especially in larger cat populations. So we see it a lot in shelters, rescues, breeders, and catteries. But like if we tested all of our cats for exposure to coronavirus, they probably, most of them would test positive anyway, just because it is so communicable. So when the virus mutates in the cat, first they get infected, and I'm going to try and use the little pointer here, which is really cool. Let's see. Over here we have the cat that is infected with feline enteric coronavirus, FECV. It goes into the cat's GI system. It then replicates within the wall of the GI tract. It then goes to their lymph nodes because their immune system wants to take care of it. It replicates in the tonsils and the lymph nodes, all of that into the immune system, the small cells in the immune system. And at some point in a very small subset of cats, it will mutate and then cause the FIP infection. So most cats who are infected with coronavirus will never have any problems. They have a little diarrhea, it's done. We probably don't even know why they had diarrhea because we don't really test for coronavirus because it's so ubiquitous within the cat communities. But then some of these cats will mutate into FIP, and we think this is secondary to their own immune stimulation with the original virus. So how often will it mutate? They'll mutate, they say in the studies, 5 to 12% of cats will have the mutation, 3.3 to 10. That's a really wide range. It's because all the studies are really difficult to do. We're not going to ethically just infect a bunch of cats with coronavirus to see who develops it, especially in years past when we didn't have a treatment for it. And so the study is really wide range, but I would say, somewhere around the 5% mark will develop clinical disease. Again, the damage happens to their bodies as well. That the fluid, the inflammation, all of that happens because of the patient's own immune system attacking that virus because of the mutation. It's transmitted through fecal-oral route. So these kitties will get it from sharing litter boxes, grooming each other, sniffing each other's poop or interacting with each other's poop. So in our outdoor feline populations, that's going to happen. You can't control it. In our indoor feline populations, once one cat has FIP, all the cats that it shared a litter box with without its life might have encountered coronavirus at some point. So it's really difficult. A lot of times people ask me about quarantining these cats, similar to, panleukopenia. Would you want to quarantine them? The answer is no, because their housemates have probably already been exposed anyway. It's probably not going to make a difference whether we quarantine these cats or not. What does it look like? Literally anything. It can look like anything. We see body effusions, so fluid in the belly, fluid in the chest, fluid around the heart, peritoneal, pleural, and pericardial effusion. GI distress, one of the most common signs is not eating. So if a cat's not eating, especially if they're normally a really good eater, that's a huge sign of there's something going on. It might not be FIP, but there's something going on with that cat. Vomiting, diarrhea, excessive drooling, weight loss. We can see immune issues, so fevers, enlarged lymph nodes, neurologic issues, trouble walking, changes in their meow, abnormal mentation, even seizures we can see. But if they're just not acting right, they definitely need to be checked out for this sort of thing. Ocular issues, vision trouble, increased or decreased eye pressures, which can be painful. It'll make your cat kind of squint. And then bloodshot eyes or blood within the eye. If you look at your cat's eyes and they're red, that's a sign they need to be checked out. And then multi-system inflammation. We might see it, elevated kidney values, elevated liver values. They might have really severe skin infections that just aren't, normal for this cat or aren't, attributed to anything else. So we do our diagnostic tests. We do blood work. We all know about the low albumin to globulin ratio. That's one of the things that us vets look for when looking for FIP. This is one of the hallmarks, but a lot of things can cause a low albumin to globulin ratio. The globulins increase because of inflammation and immune stimulation. We might see those liver and kidney values elevated. Often we will also see anemia. A lot of times we'll want to run x-rays or ultrasound to kind of see what's going on in that belly and what problems might we see. On this particular slide, let me see if it'll give me the pointer. We can see in here, this is an ultrasound. So ultrasound fluid is going to be black and tissues are going to be this gray color. So here's the left kidney. This is probably the spleen over here. And then we have all of this black effusion. And that's one of the tests that we run at the clinic to see. Things that you'll see at home would be a distended belly. So muscle loss, you might pet your cat and feel the bones over the top of your cat, but their belly looks really, really distended. And there's no singular blood test. There will be labs out there. And if you go to other vets, Dr. Reynolds, I know practices really good medicine. But if you go to a vet that says, oh, there's a specific test for coronavirus or FIP, it's not very reliable. Not reliable enough, at least, to recommend it. So I wouldn't spend money that way. What we do is we used evidence from all of our diagnostic tests. We take all of those puzzle pieces, kind of put them together and see how likely FIP might be. Sometimes at the end of the day, if we're unsure if it's FIP, we end up treating with the medication because there are fewer side effects of the medication, and FIP untreated is a death sentence. And so sometimes we will treat just to see if the cat responds. That's not a situation that we like being in, but if all of our blood work and x-rays and ultrasound kind of point towards that way, sometimes if we're not 100% sure, we will treat just to see. What does treatment look like? It used to be, there was no treatment. Now we have injectable and oral treatments. The injectable and oral treatments up until recently have been through illegal sources. China, having drugs sent over to the US because of issues with licensing and manufacturing and all of this within the United States. There are Facebook groups and global groups that will import medications to try and make sure that these cats have a chance to live. And I know anyone that has been working with a lot of our FIP town cats knows that intimately well. Recently, there are a few non-FDA approved, although the FDA is looking the other way from these compounding pharmacies, compounded oral sources. I have not seen any compounded injectable sources that have been through our US pharmacies, but I know Stokes Pharmacy and recently Wedgwood both have oral tablet and liquid compounded medication for these kitties. And then remdesivir. I like to highlight remdesivir because that's kind of what they were studying for FIP before human COVID-19. This is the reason my husband's alive today. He was hospitalized with COVID in 2021, and he got remdesivir, and every day he got it, he got a little bit better. So again, intimately know about coronavirus there. And it is thought that the remdesivir might be able to treat FIP as well. We just know a little bit more about GS 441524. FIP Global Cats is one of the Facebook pages that allow, they're able to get some of this medication for our kitties here. So 12 weeks of treatment is the recommendation. We don't really have a lot of studies on what it would look like if we did a truncated course. I know you were talking a little bit about if somebody runs out of money and the cat is clinically well, they should probably be okay. However, I have seen, I think, 2 cats that relapsed that I know of because of a foreshortened treatment. One of them, I think, did the full course of treatment and then had to do another course of treatment, but ended up doing well. The relapse rate, from what I've seen anecdotally, very, very low. The different types of FIP. Wet, which is the effusive version, the fluid in the belly, fluid in the chest. requires a lower dose than if we have the dry version. So that would be the neurologic changes, the GI changes, liver and kidney changes. And each cat is different. From what I've seen recently out of the recommendations is we start at the standard dose. If the cat is not responding, then we increase that dose. Side effects, transient elevated liver values. Our liver is our filtration organ along with our kidneys, so it makes sense that the liver values would go up with a new drug. There are a lot of other drugs that we use that make the liver values go up. Sometimes we can see white blood cell changes, sometimes we can see diarrhea. But given that FIP is deadly without treatment, a lot of times the benefit outweighs the risk of these side effects. But it is one of the reasons why we recheck blood work and we recheck all of these things as we go through treatment. So case study, Olivia. This is not Olivia, by the way. This is just a cat that's kind of drooling. I did not have a picture of Olivia. So this is a cat that's kind of drooling, and that face is what Olivia looked like when she came into my clinic. It was also before I got permission to use Olivia as a case study, and I didn't want to have to use her picture. But she came into me kind of looking like this. We see the squinty eyes, the drooling, the mouth kind of hanging open a little bit. This cat looks uncomfortable. If you saw a cat like that, you'd be like, that's not a happy cat. She's 4 years old, female spayed, domestic short hair. Presented to me originally for kind of a wheezing when she breathed. Oh, do you have a question? Yes. So the question is that a typical face of a cat that might not be feeling well? Yes, absolutely. Your kitty is looking like this and not eating, that's a reason to bring them to the vet or to talk to somebody about what's going on with that kitty and what their normal looks like. Absolutely. This is not a hallmark of FIP. It could be anything else. Olivia came in with us not thinking it was FIP. And so we were just doing a full workup on her when she came in. She presented for wheezing, breathing through her mouth, but it wasn't necessarily like panting like a dog. I think we all know that when a cat is panting like a dog, they need to come in right away. But she was just kind of holding her mouth open and just breathing heavier. She was hacking. She had an increased respiratory rate. She hadn't been eating or drinking for a few days. And she had this recurrent eye discharge that, was treated and it'd get better and then it'd get a little bit worse again. We took x-rays of her chest and abdomen. Her chest was normal, hence why I didn't put these pictures in. But when we took x-rays of her abdomen, I think we can see that anything black is air. And all of this is her intestinal tract. So her stomach here, her intestines, her colon, and you can see a little bit of poop in that colon. But all of that is incredibly abnormal. Let's go back to this picture. Yeah.
So somebody was eating, then she walked over and I said, she's standing there.
Yeah.
And then she'd walk away licking because her nose had been running.
Yeah.
I didn't realize
and that's really easy, especially in a multi-cat household. If they share bowls, if they share all of these spaces, just because the food is gone does not necessarily mean everyone is eating the same share. I certainly see my fair share of bullying between cats to get to the food as well. But that's where, sometimes if maybe you just have an inkling that something's wrong, take that cat and put them in your bathroom and just see, are we eating? Are we acting normal? I wouldn't want to eat if my guts look like that. This, with the amount of air in there, that's incredibly painful. We all know what it feels like when you have the gas cramps. It's really bad. She also, it's hard to know her litter box. Right here, we see stool in the colon, but the colon is big and flaccid and floppy, and the stool is hard and just kind of sitting in the middle. When we poop, all of that colon muscle is supposed to push everything out. And all of basically what I surmised from these x-rays is all of her muscle was just really flaccid. Everything was just full of air and floppy. So when I saw that, the next thing we did, here, differentials for here. Intestinal ileus. So her intestines weren't moving. Dysautonomia basically means lack of innervation to the intestines. They get really dilated and stop moving. We need that active peristalsis to move things through. That can be its own primary issue to begin with. And I was worried about that when we first saw these. And that is also a very difficult thing to treat. Addison's disease, where didn't have enough steroid hormone. Sometimes we'll see things like this with mesenteric torsion, where their intestines literally twist on itself, and we see a gas pattern like that. Intestinal parasitism, it have to be pretty bad for that, but worms can cause stuff like this. And then FIP was on my list. Her CBC, so white blood cells, red blood cells, platelets, we talked about that anemia. Hers was within normal limits. Her CBC was normal, but her globulins were high at 6.9, and her albumin was low at 2. So her albumin to globulin ratio was 0.29. Anything less than 0.8 is suspicious. If they have a lot of the other signs is less than 0.8, I'm suspicious. Anything less than 0.5 is suggestive of FIP. So that's something we look for. Other things that can cause the albumin to globulin ratio to change: autoimmune disease, other types of infection, cancers, IBD. So just because your cat has a low albumin to globulin ratio doesn't necessarily mean it's FIP. But we use all of our context clues to try and figure it out. This is Olivia, 1 week post-treatment. So we can see here, her stomach doesn't have that air distension anymore. Her intestines, these are normal. She has a nice tense colon with a big ball of poop right there at the end. But we can see that it's not floppy. She has the musculature to get that out of her body when she needs to, when she decides to. This would be, if I saw this on x-ray, this is a normal cat to me. 1 week post-treatment. And for Olivia, we treated with a little bit of caution of it might not be FIP, but if she responds, then that's diagnostic. So she's one of those cases where we took all of our context clues. We said all the other things, cancer, dysautonomia, all of that. We can't necessarily treat those things. But if it's FIP, we can treat it now. And so we treated it, and she got better. So yeah, before and after, pretty striking.
Dr. Carlson, before she drew the blood, that was the last minute thing. All ready to drive up the blue pearl.
I was going to refer Olivia.
That day, 2 hours. We're talking 4 in the afternoon.
Yeah.
But then you said, let's take some blood just to see.
Yeah. Well, I said I didn't want to send her 2 hours away to a specialist and not have run blood, because if she was in kidney failure, if she had something else going on, it might not have even been the best thing to do to take that ride. And then I saw the albumin to globulin ratio. Then the first thing I did was I FaceTimed with Dr. Reynolds because she is also, she's my FIP guru. As much as I'm giving the talk, she is probably seen the most cases out of anyone here on the Eastern Shore, especially with you guys. And she was like, yeah, it can look like anything. It can look like anything. So we said, instead of referral, because I was nervous that the specialist might not even use something like an illegal drug to treat FIP, I said, why don't we try treatment? And if she doesn't get better, then referral is still on the table. And that's when we tried the treatment. So yeah, I didn't include that. I know it was kind of a crash course in FIP. There's a lot of different ways that it can be, looked at. It can look like anything, though, and that's the big thing that I wanted to harp on is if your cat's not eating, if your cat is, having diarrhea, if your cat is, if their abdomen is distending, even if they're not eating a lot. Those are things that we need to check out as soon as possible to rule this in or out. Does anyone have any questions about FIP? Yes. So there's technically 2 kinds of FIP, wet or the effusive form. This would be fluids building up in the body cavities. The second one is dry FIP, but that also has subtypes. And so the dry FIP is the immune response that does not form any sort of effusion. So it's kind of an umbrella term. That can manifest as kidney issues, GI issues, neurologic issues, which is one of the subtypes. It requires a different dose of medication because it needs to penetrate through that blood-brain barrier. And we see ocular. So some cats, if they acutely go blind, if they're squinting their eyes, if you see any blood in the anterior chambers, and I know that with your lymphoma kitty, that was one of the things that I first had on our list as well is FIP, because we can see blood or hyphema in that anterior chamber associated with FIP as well as certain types of cancer. Great question. Anyone else? Okay. Yes. The question was, has anyone postulated why this has come up, given that we haven't seen nearly this many cases in previous years? The answer is we don't know. I thought potentially, especially with COVID being so prevalent, could there have been some crossover between COVID and FIP, where maybe seeing this additional virus, similar to how some bacteria can teach other bacteria to be resistant to antibiotics, maybe this mutation could have been transferred from virus to virus. The long answer, or the straight answer, is we don't know. Certainly it's something that I've postulated personally, but it has not been proven. And when I've brought that question up to specialists in the infectious disease field within veterinary medicine, they do not think there's a link there. But it's hard to know for sure. I don't think there's a way that we can study it where we can know 100% unless we physically see that. Now, with COVID-19 and very few, but some young kids, there were some systemic inflammatory syndromes that they were going through, and it kind of looked like an FIP sort of situation. But at the end of the day, we really just don't know. But it's something to postulate for sure, and something I'm sure that's going to be studied for decades. I mean, this is all relatively new. Even COVID is still relatively new compared to like a lot of the other diseases that we deal with. So, yes. Has coronavirus? Yes. So coronaviruses have been on this earth as long as people have been on this earth. These enteric coronaviruses in cats have absolutely been around for hundreds and hundreds of years. The big thing, we think about the SARS outbreak in Asia early on, a decade ago or so, and that was well contained. It was just that this particular COVID-19 turned into a global pandemic. And so that's when we started talking about it a lot more. But yes, absolutely, it's ubiquitous throughout the feline. Canines have their own version of coronavirus. A lot of them are species specific, though. Chris, yes. Sure. Yeah, it was a diagnosis that we never wanted to give either, because it was always a death sentence. So yeah, the question was, maybe there were cats that were underdiagnosed in the past because we just didn't know what to look for, and now we're just so more acutely looking for this sort of thing. Absolutely. I do know of town cats that have had FIP in the past prior to treatment with the effusive form, which is easier to diagnose because they have a lot of fluid everywhere. And so you pull that fluid and it's highly protein-rich fluid. There's very few things that are going to cause that sort of thing. But with dry FIP in particular, we could have chalked it up to maybe a brain tumor, maybe, some other sort of neurologic dysfunction, maybe cancer, and maybe we were underdosing or underdiagnosing FIP in the past. That's absolutely 100% could be the case, for sure. Yes. So wet and dry are treated the same way, but the dose of the medication is different. And so for dry and neurologic FIP, we tend to use much higher doses of these medications compared to the effusive FIP. And they could have both. There are some cats that we postulate did have both versions within one cat, in which case we treat with the higher dose of that medication. If they're not responding to the low dose, we go to the high dose. There's a lot of unknowns in this, especially with the fact that this isn't a drug that is made, at least right now, by a manufacturer who have to go through the FDA and have to prove with clinical studies. Given that most of us have dealt with the illegal form of this drug to save cats, which is absolutely the right thing to do, it has not been, even through universities that have all the, a lot of funding, it just hasn't been studied well. But what they're going to do is retrospectively look at a lot of these cats that have been treated and be able to do cohort studies of the cats that have been treated with the illegal substance to then make a name brand, which I'm sure is going to be incredibly expensive, just like the medication that we're using now. It's a large dose, especially for a cat like Olivia with a dry form. It's a large dose. It can have side effects. The injections we've seen, like sterile abscesses and things like that at the injection site, and it's painful for the cats a lot of the time too. So that's where we also have this moment of, Obviously, our owned cats or our cats that are very tolerant of being handled are easier to treat than our cats that maybe aren't great adoptable candidates, or if they're already in a feral or semi-feral situation, and then you're stabbing them with very painful injections every day. It doesn't create that bond that you want with that cat to be able to be adopted. For sure, it's very difficult, and that's it too. Is the bigger the cat, the larger the dose, the more expensive it ends up being. But Wedgwood, yeah. Recently, Wedgwood has released their version, and we already go through Wedgwood through our vet source, and so it makes it much easier. I will often just call Wedgwood if it's not. Haven't checked through vet source if it's available through there, which is our VCA online pharmacy. But we could contact Wedgwood directly. I did sign up for Stokes, but it's a bit cumbersome to deal with multiple different pharmacies. Now that Wedgwood has it, I'm just going to stick with Wedgwood. But Dr. Reynolds is, using Stokes, but the illegal version as well was also incredibly expensive. So I think when Dr. Reynolds and I did the calculation, I think it's right about the same price per cat compared to the stuff that's coming in from overseas. And obviously there's better quality control at a US-based compounding pharmacy. We've been very fortunate to not have any adverse events that I know of with the overseas version, but you always do run the risk of not getting exactly what you wanted in that product, or having that product contaminated with something else that might harm the cat. So compounding, this is a great side note, but yes. So when we go to our regular pharmacies and we get either generic or name brand drugs, those are from the manufacturer, who have very, very strict rules set by the FDA that they need to follow to make sure that whatever you're getting is the actual product that you're getting. So if you get 100 milligrams of gabapentin, I think there's like a 1% deviation that they're allowed to have, or a certain deviation they're allowed to have. And that's why sometimes things go on back order, because maybe a batch was wrong. They pull that batch before it ever hits the pharmacy. Compounding pharmacies, what they do is they take the raw ingredient and they make it into a product that is specific for that patient. So they'll take, let's say we needed gabapentin, but this cat won't take pills or anything. We need a liquid, but we need a liquid in a specific concentration. So they'll take gabapentin, mix it with the flavored liquid, and then sell it to you that way. So that way you can dose your cat exactly how it should be. And we do that with a lot of drugs because our cats aren't always compliant. We do that with a lot of drugs because there might not be a human version of the formulation that we need for that cat. Or like things like, methimazole, we could do transdermal. So a cat won't take pills at all. You can do a lotion that you put on the inside of the ear for a hyperthyroid. Now, with compounding pharmacies, you also get a little bit of that user error. You get a little bit of the pharmacist error. We're all humans. So this pharmacist is making it specifically for that cat. They're going to have less quality control compared to the manufacturer. And so they've actually done studies with certain compounding pharmacies where they order the same drug at the same dose from every pharmacy, send it to a lab to get analyzed, and some pharmacies will have 75% of what they said was in it. Some will have 125%. And so most of them are, especially the major pharmacies in the country, are going to have a pretty good percentage rate of being close to that baseline. But there are certain ones out there that'll be 0%. We see this a lot in supplements. The supplements over the counter. There's some supplements that 0% of what they say is in there. There's some that are 800%. And you're like, would that be an overdose? Maybe, we don't know, because it doesn't have to go through the FDA. And so this is our next best thing. If we wanted best quality control, then when Gilead or whoever the manufacturer is that makes this stuff for us, that will be the gold standard. Compounding will be kind of the silver. And then the international stuff would be the bronze, because there's so much less quality control there. Was there another question? Yes. That's a really great question. I don't think so. But that would be, to postulate that would be really cool. Like to have that as a potential in the future, especially given the efficacy. My concern for vet med are a couple things. Is one, as much as we see a lot of it because we deal with a lot of cats, in the average household cat, it would be pretty rare for that cat to develop FIP. So a lot of our vaccines are to things that are either deadly in the sense of it's hard to treat, so like our panleukopenias, that sort of thing, or something that this cat is going to, have a high likelihood of developing without the vaccine, or a public health risk like rabies. And so I think there just wouldn't be money there in the grand scheme of things to develop one. I think it'd be really cool if we could, especially for shelters, humane societies, rescues specifically. That cat comes in, you vaccinate it, and then we would have a higher, likelihood of being able to adopt out that cat and be like, yes, your cat has been vaccinated. But like in humans, it's also not going to be perfect. And so like, I know I'm vaccinated. I get my vaccine whenever I can. But I've also had COVID through the vaccine. Now, has my symptoms been much better? I think because I was vaccinated, sure. But I don't know if it'd be 100% preventative. And I think it'd be cost prohibitive, most likely. But yeah, there's not that on the horizon as of yet. But we'll see. Who knows? Sure. The question was, how do we disseminate this information to veterinarians? Because there are veterinarians who are out of the know when it comes to most current therapies in FIP. We as veterinarians are required to do continuing education hours, but we could do that in any realm of veterinary medicine, no matter what. In practice management, you could do it in GI diseases, you can do anything, but we need a certain amount. I think now that we're having compounding pharmacies that are allowing us to do this legally in the US, there's going to be more and more classes on it, but it's all self-study. And so unless that vet is in the know, in the Facebook groups, looking out for this sort of thing, they might not even come across this information. And goodness knows there are some vets who still practice what we call old school medicine. Everything that walks in the door gets a shot of Depomedrol and a shot of Pen-G, which is Depomedrol is a long-acting steroid that can cause diabetes in cats if we're not checking for it. But it helps with inflammation in certain places. So usually the cat's magically better, but we don't know why. No diagnostics were run. We just gave it a drug and hope it got better. Or Pen-G, which is an intramuscular antibiotic, which is inappropriate to use in cats because of injection-related sarcomas and things like that. But there are some vets who will just do it. They're usually the same ones who, don't believe in pain control for things like spays because it's better if the animal's not moving after the spay so they heal better. Well, no, we know that that's not true. Multimodal pain management is actually essential in healing our bodies, and healing their bodies. And no animal should undergo a surgical procedure, especially an abdominal procedure, without adequate pain control. But there are, they used to teach that 30, 40 years ago. And so I think the big thing is making sure that we stay up to date as possible. And when you do go to a clinic, the big things that I look at are, do you know the vet? Ask them questions. Be very honest and just say, I'm curious, why are we doing this on the plan? I will never bat an eye at answering all those questions when you're in an exam room with me. I will explain everything almost ad nauseum. Like my clients and my techs are tired of me talking. And then also looking for like an AHA certification or some sort of certification with the clinic that they work with a larger body to make sure they maintain a baseline standard of care at that clinic. And so those are things, especially if you're traveling or something like that, if you have to move away, those clinics, those vets are most likely up to date because it takes a lot to get your AHA certification. It's the American Animal Hospital Association, AAHA, AHA. And they come in, we have our inspection next week. They come in, they inspect everything, and they keep clinics at a high standard of care when it comes to those pets.
Have journals like JAMA?
Absolutely.
And have
Yep.
you written any articles?
Recently, not that I know of from a journal standpoint. However, there have been non-peer-reviewed articles written about this in a lot of different veterinary magazines, and certainly on VIN, which is our Veterinary Information Network. That one is message boards of vets and specialists and all sorts of people. So if I have a question about a case, a lot of times I'll go to Vin and see. Somebody else probably has asked that question before, and I'm able to narrow down my differential list and things like that based on that. But I do expect it in the future, absolutely. The compounding pharmacies, are they vet specific or do they do human meds as well? The ones that I tend to use, Wedgwood, I believe, I'm not sure about Stokes, but Wedgwood for sure, I believe, is veterinary only. There's other ones like Roadrunner. When I was out west in Albuquerque, Roadrunner Pharmacy was the big one out there. They are veterinary only, but there are certainly human veterinary compounding pharmacies as well. I do know that with human health insurance and all of these things, a lot of times those meds will not be covered, mainly because you don't have that same quality control, and there's problems in human medicine when it comes to insurance companies and payouts and things like that too. But there are human compounding pharmacies. I tend not to use them, and a lot of them, if they do have a human version, they'll have a veterinary sector as well. I know like Coastal Drug over here, they will do some compounding, but they don't do any sterile compounding. So they don't do injections and things like that, but they will do like ophthalmic meds and other types of meds for animals, as well as people at certain smaller pharmacies on a smaller scale. Great question. I was going to put that in there that historically it's young cats, but anecdotally, cats of all ages. They used to say between 1 and 3, but now we're seeing 4-year-olds, 8-year-olds, 12-year-olds. We're seeing everything. Yeah, now I tell my clients any age, because I don't want someone to look at their cat and be like, well, he's 5. It can't be that. I don't ever want it to be ruled out because of age, because we've seen too many cases where they could be any age. But historically, yes, they would say young adult cats were the cohort.
I think it might take that length of time for that virus to mutate.
It's possible, but we don't even know when it ends up doing that. A lot of times the theory is that it lays dormant in their GI tract and in their lymph nodes and in their body, and then something, stress or something like that, triggers the immune system to then mutate the virus, is the thought of what happens with that, and which is why some cats don't ever develop it and some cats do. But that's still in its theory age. We could do the same talk in 5 years and things might be very different. We don't know. And she could have been exposed at 4 days old or something like that, and it lays dormant and then comes out when she's 4 or 12 or whenever. We don't know.
What is your theory of where it came from?
It's fecal oral route. So I will say that it is yeah. So the fecal oral route, it's just like that gross study where they tested everyone's toothbrushes in their bathroom and they're like, oh, there's poo particles on here. Yeah, so they, even in a crate, when they go in the crate, when they fart, it can aerosolize. And if they're not showing symptoms, they can still shed that virus. That's where the sharing the litter boxes, even after a quarantine period. If they already were, and it could have been not even that kitten, she could have been exposed at 3-4 weeks old. And we don't know, but it's one of those things where if you have a cat in a bubble for its entire life, will it probably not get it? Sure. But you can't keep a cat in a bubble. You're going to get new cats. You're going to get, yeah. I'm sure she smelled a lot of cat's poop when she was out on the streets. Yeah. So do any cats build immunities to these type of things? I'm not sure. Another, most cats, I will say, they're exposed to the virus and they recover from the diarrhea, and then they could intermittently shed the virus the entire life and it will never mutate. And would that be considered an immunity because they're not clinically unwell at any other point in their life? Maybe. But at any point, could that be like a little bit of a ticking time bomb of that mutation happens and then all of a sudden it's FIP? Another big question that a lot of people have is, can they get reinfected? The answer is, I don't really know. I don't think we've had enough cats. And to my knowledge, I don't think we've had any cats that were like clinically FIP, went through the 12 weeks of treatment, other than that, like a relapse here and there. But like then long time from then get FIP. I don't think so. So in that case, could you say their immune system would be like if they were to re-mutate again, their immune system would take care of it before clinical FIP because they survived it once? I don't know. I don't know. And we don't even have like an antibody test or anything like that to differentiate the FIP virus from the feline enteric coronavirus. So that's where a lot of those lab tests really are terrible is, yeah, it'll say your cat was exposed to coronavirus at some point in its life. Well, so is 85, 90% of the cats we see. It's not a diagnostic test. And they can't differentiate between the two, the regular virus and the mutated virus. Absolutely. All right. That was good.
Thank you so much.
Of course.
Lark, you had something?
No,
Okay.
cool.
Thank you so much.
Yeah, thank you guys. Thank you for having me.